Endocrine diseases impact 13 million US citizens. While you may associate these diseases with diabetes and thyroid issues, steroid hormones such as estrogen, progesterone have been studied much less in endocrine disease research. 80% of women have some sort of hormonal imbalance, and more than 70% of these women are unaware of their condition. Hormone imbalances include polycystic ovarian syndrome, infertility, hypogonadism, endometriosis, and more. PCOS affects 4 to 12% of women, and it costs $8 billion in healthcare with an additional $4.3 billion towards related conditions. Historically, medical research has been focused on men, which has led research data to be generalized towards women. These generalizations have impeded research on female hormonal health, specifically hormonal cycles. Existing hormone monitoring devices specific to female cycles lack the ability to run continuous tests or deliver hormones when needed. We aim to develop a well-defined diagnostic criterion to treat steroid hormone imbalances through continuous tracking of estrogen and progesterone.
Our approach allows for continuous hormone profiling. In reality, hormones change from every hour to every day to every month to every year, so a one-off test does not create an accurate representation of someone's hormone profile. Our device has the capacity to run over 250 days without any maintenance. Specifically, that's a total of 500 tests with 2 a day. So how are we going to do that? We will utilize a microfluidic device that will sit on an adhesive and go on any fatty surface in your body. This device will have a cannula that sticks into your skin, just like a Dexcom, and will be connected to a monitor. The microfluidic device will gather sample data which will be sent to the monitor to interpret and administer hormones accordingly. Let's take a closer look at the microfluidic now. We will utilize techniques from ELISA and SERS for detection and amplification of fluid flushes for repeatability and sampling. At the start of a test, different compartments of flush solutions are open and flow through the side channels of the microfluidic through simple capillary flow. There are a series of 4 fluid flushes that occur per test. The center channel is lined with fixed gold nanoparticles. During the first fluid flush, specific detection antibodies with high affinity and specificity to our target hormones, progesterone and estrogen, are released into the side channels and bond to the gold nanoparticles due to static attraction and bonding. Then the second fluid flush opens a valve from the cannula, which allows blood to flow through the channels, and any target hormones present will attach to the antibodies. Next, we will have a DPBS flush to clear away any excess proteins. And at this point, a process called spectroscopy occurs, where a light is shined onto the side channels. Due to the very specific amount of light that is bounced back onto the sensor, we can determine at which concentration and what hormones are present. Based on these results, the pump monitor will release specific quantities of hormones into the cannula to correct any imbalance. Before the next test occurs, a dichloromethane flush and one more DPBS flush will occur to purify the gold nanoparticles and clean away the channels for the next test. Now, this may look a little bulky and intimidating, but remember, this is a microfluidic device. So the total amount of fluid required for a lifetime of this device amounts to 2 milliliters. The total length of this device is just under 2 inches, allowing for a safe, continuous, private method for patients managing hormone imbalances.
So how does this actually benefit the user? Continuous tracking can help detect imbalances or fluctuations early and inform treatment to improve quality of life of the user. As mentioned previously, a blood sample or hormone panel is a singular data point that can be at the peak, valley, or middle of a given hormone cycle, which does not give enough context or understanding to help an individual. Our continuous device will not only get a full picture of the user's hormone cycle, it will significantly reduce the cost people might face, as hormone panel tests cost up to $250 per test, and testing biweekly will only give a vague idea of the patient's cycles while costing roughly $7,000 annually. The upfront cost of our device, along with discussion with a healthcare professional, will not exceed this cost, and as the device will be refillable and reusable, the return on investment equals out the cost. While there is immense resources needed to treat hormonal imbalances, our device provides a step in the right direction to improve the quality of life for those suffering with these imbalances.
So there are 2 products currently on the market that we believe compete with our device. First being an insulin pump, which is a type of continuous tracker. This delivers insulin continuously throughout the day, giving dosages as needed when it gets low. The major limitation that comes with this device is the cannula gets blocked due to body movement. This can offer real-time and precise monitoring and early detection of hormone imbalance, where it can cost, and this device can cost around a couple $100s. Next, we have mirror trackers, which are a type of hormone monitor and fertility tracker that uses urine samples to measure hormones like LH and FSH and estrogen. Major limitation comes from not continuously tracking, and the cost for this device comes to be about $200. And this is our sources. Thank you.